Hi friends. Now it is my privilege today to introduce to you Dr. Anurag Kumar. He is ranked 65 in this November 2019 AIMS. He is a 3-year DAM student. He did his foundation course with us, then in final year, and followed it up with a test and discussion and internship. Anurag, we are really proud of your achievement.
Thank
And
you,
how are
sir.
you feeling today?
Sir, I'm feeling relieved, like more, I would say I'm relieved more than happy. All the stress which was piled up in this 1 year, it has been released now after the result.
At least when you see the
Yes, sir.
result and now you know that
Yes,
okay,
sir.
this part of the journey is over.
Yes, sir.
Yeah.
I'm out of the rat race.
Yes. And
At least for some time, I
at
don't
least
know.
for some time till the time you see the
Yes, sir.
next entrance exam
Yes.
coming your way. Uh, so Anurag, how was your experience when you joined us in the 6th semester for the foundation course? How was the experience with the classroom program?
So when I joined DAMS, my target was to attend all the classes which I did. So after attending the classes on weekend, I targeted to revise all that in like next 5 days, so that it remains fresh in my mind. So that when I read it again in during internship or final year, it's not like I'm reading some alien notes. So that was my plan. And the notes were really concise, which helped me both during profs and for PG preparation also. And the classroom teaching, like they were very conceptual. It was not like they were just dictating notes. They always tried to clear our doubts whenever we used to ask something.
Now, when you look back, are you now happy with the decision that you made at that time to do the classroom program at that time?
Yes, sir. When, like basically in first year I didn't study much, and after in third semester I started studying standard books. But then when I reached fifth semester, I realized that I was not able to make notes by myself because it is very difficult to do it. Then, like all my seniors had joined DAMS and they had achieved good ranks, and I used to watch their videos, and it was my goal also to give an interview with you,
Now
sir.
you're finally giving
Yes,
the
sir.
interview. Did you prepare? What will you speak in the interview?
So not really. I thought I would, but then didn't get the time to.
Yeah, maybe we'll
Yes, sir.
extract that from you today.
Yes, sir.
And then you followed it up in final year, and you were telling me that initially you had not done the first second year classes, so you did them in the final year.
Yes, sir.
How was your experience with basic sciences classes?
So, sir, anatomy and physiology, they were my weak subjects, and I had to do something about them because I thought that I would not get that much time during internship because it's somewhat hectic to do internship and then study again because I have to revise all the other subjects also. So I thought I'll do them in final year, and after that I'll revise them again. So I attended Sandeep Madan sir's class and Dr. Anupma ma'am's class also. So they were really good, and the notes which I made, I revised them in internship also, and like physiology was helpful even for profs, especially the cardiology part. So I think I did the right thing because like some people think that you should focus only on final year during final year, which I think is not really the right approach because in AIMS roughly 100 questions, 105 questions are from first second year subjects only. So
Yeah, we're considering that in mind nowadays, like now your juniors now, they are mostly joining us in second prof
yes,
because they believe that it is important to be thorough with those 7 subjects also, because in AIMS I think 50-50 ratio we can
Yes,
roughly say that 50% will be
yes, sir.
basic sciences.
Yes, sir.
Hmm? And then you followed it up with a test and discussion in internship.
Yes, sir.
So how was your experience when you shift from a classroom is a didactic teaching
Yes,
where
sir.
we teach. TND is like first we take test and then we evaluate. How was your experience with the TND pattern?
So I think TND was an add-on. It was not that they were asking questions, all the questions from the notes. There were some questions from the notes, obviously, but some questions were really new and which I in for some just subjects I added them in my notes, and for some, like for example in Ops Gynae TND, like I revised it whole because I thought because according to me most of the stuff was new. So I think TND is very important because you have to apply whatever you have learned in those 2 years, and most of the people don't have the habit of solving MCQs while reading standard textbooks or preparing for profs because most of the questions are subjective. So you have to do the questions, and you can start in 8th semester, but I think by the first month of internship you should start doing all MCQs.
And I also agree to this that in TND our purpose are dual. One is to make sure that you learn to how to apply what you have learned with us, and second is to give you some updates.
Yes.
Like what happens is when we are teaching you in
Mhm.
sixth semester and when you come to us in internship, there is 3 years gap
Yes,
in
sir.
between. In those 3 years, around six AIMS papers would have
Yes, sir.
happened, many new updates would have come,
Yes, sir.
and there will be things that which we would have added to our curriculum in that
Yes,
year.
sir.
So we give them
Yes, sir.
give those updates to you in form of TND questions
Yes.
also.
So even DAM's last look is like serves the same purpose,
Yes,
especially
yes,
for PSM.
yeah. The reason is because majority of the students are joining us in second year and third year, so we have to have a mechanism for them
Yes,
in
sir.
the end. So
Yes.
if I give them full books at that time, they will not do. So we have that last look to cover up the
Yes.
idea. And how was your experience overall when you look at the entire curriculum that you attended with us, the TND, the classrooms? Were you happy with everything that how we had planned it?
So I think the in planning aspect DAMS is very good because like initially I thought why not studying first and second year subjects in sixth semester and then finally doing uh, like third minor and third major in 8 9. But I think in the end it was more helpful.
Because actually, our reason is that in the eighth semester you would not have that kind
Yes,
of
sir.
time that is
Yes, sir.
required for the
Sir, I
teaching.
realized it only
Ah,
when I
ah,
reached ninth
ah,
semester.
ah. And I also want to know from you, did you attend the DVT session that we conducted?
Yes, sir. I attended DVT. Due to certain reasons, I could not attend it complete. I attended one day, and on that first day, I remember your words, "Dhakka maar motivation," because I lost somewhat. Like I lost my motivation due to certain personal reasons. But then I thought I'll do just this. I'll study one subject for 2 days, other for 3 4 days, and like that I continued. And in the last days, because I missed 2 days, so I had to revise. Initially, I thought why like I think there was a debate on DAMS group about whether we should give handwritten notes or videos. But I think videos were great because in the last 3 4 days I lost the motivation to study because of stress about how the exam will go. So I watched DVT videos, concise videos, and I solved the MCQs. I think it covered the 2 days which I missed.
Yeah. And I think my goal there was to keep it very brief,
Yes.
but I wanted to add a teacher's voice to it because my belief is in the exam when you are trying to recall, a teacher's voice would come back. See, this is the
Yes, sir.
seashore, this is the
Yes, sir.
stratosphere, and because if I just give you the PPT slides and everything, it will all add to the bulk that you have to do, and it would require a lot of active intervention from your side to
sir.
try to recollect
Yes,
what
sir.
was being said.
Yes,
So
sir.
that is why we
Yes,
created
sir.
that.
So it is very good for revision because at the last moment you are overwhelmed, like whether to revise this, that, or previous year questions or what. So I think because like reading takes effort and listening to voice doesn't take effort, it gets ingrained better, I think.
And how was your experience with the eMedicos app, where we have that previous papers, the AIMS paper, PGI papers, the mop-up sessions, and the
Yes,
AIMS
sir.
capsule?
So, sir, I didn't solve AIMS. I didn't see AIMS videos because I was doing that from another book. But I did watch videos of PGI a few days back, and I watched mop-up videos of EEG because there was one question on EEG in May 2019. So,
Yeah.
and we don't really study that much, even in profs. So I watched that video and psychopharmacology. I realized it was very crisp revision, covering both pharmacology and the psychiatric clinical aspect of it. Then I watched contraceptives also. Like no matter how many times you read, sometimes you get confused with the values of like copper T, how much copper is there, and also it was very good. Then sir, in the last 10 days, actually sir, your video came about what to do in the last 7 days before AIMS. So you had written revising notes and DAMS DVT AIMS capsule. So I watched AIMS capsule videos. I watched around 10 of them and they were very good. I think 1 or 2 questions also came from them.
I think the AIMS capsule was a good high yield
Yes, sir.
thing. It's a short duration thing, and
Yes, sir.
I think in the last 3 AIMS exam, we've always gotten
Yes,
a
sir.
question from that capsule.
Yes, sir.
And I also wanted to know from you, like when you were giving this AIMS exam, like now you've done it and you've done it well. Will you be able to, like, suppose somebody has to give the May exam, somebody has to give the May 2020 exam. Any advices for him, like like we were discussing that how November and May aims have a slight different feel.
Yes, sir.
What topics would you recommend somebody who's
Yes,
May
sir.
2020 aspirant to use? And any advices for them?
So, sir, I had solved questions till May 2012 of AIMS. So, first of all, don't do questions before like November 2016 16 and beyond, because repeats are very less. And like if you have time, then do, but they should not be your priority. Only the past 3 years should be priority. And what I have seen is that in AIMS, the May exam is more for repeaters, so they ask more factual questions. For example, if you see the May 2019 paper, there was question on IPCs,
Yeah.
there was question on eponymous fractures like Schoffer fracture, Barton fracture, Cotton fracture in Match the Following.
Yes.
And sir, there was like they asked T half of pro para cane, which I don't think I was expecting that this question will come. And what I have seen is that November exam is mainly for us people like interns. So because interns generally they don't have that much time for studying, so probably this is the reason they ask clinical questions more. So someone who is preparing for May 2020, he should focus more on notes, and like clinical questions may come, but the number would be less. That's what I think.
And any particular topics that you feel were represented, like in a previous AIMS exam, they had a question on EEG. This time they had question on ECG.
Yes, sir.
Any such topics that you want to highlight for a future aspirant?
So like biostats is a very high yield topic. This time it didn't come, but it doesn't mean that it
Yes.
won't be repeated. So like
I also want to
Yes,
tell
sir.
this to students that don't think that next time epidemiology and biostats will not be there. There are no guarantees in a AIMS exam. So they try to do some shuffling to
Yes.
prevent that predictability.
So what I have seen is that they repeat certain questions which most people do wrong. For example, like there was a question on gamma delta T cells this year, which I think has been repeated earlier also. So like at that time also many people did it wrong. That's why probably they repeated this question. So the questions which are attempted wrong by more people, they probably repeat it more.
And if something is very easy, it is highly unlikely
sir.
that it will be repeated.
Yes, sir.
The topic might come, but the same question may
Yes,
not
sir.
come, is the key. And how did you deal with the visual and the video questions in the exam?
So sir, for video questions, I would recommend everyone to attend postings, because there was a question on surgery about palpation of thyroid, which like no one reads in internship unless he is actually going to ward and palpating the thyroid or going to OPD. So I think this is very important. And second thing would be to like attend DVT for visuals, and then I think revising this stuff again and again, DVT 2-3 times, it is very important for visuals, because like visuals are not really that much important. What I have seen is that they give the answer in the question stem itself. In most questions, in some as actually it is required, but in let's say 50% questions, you can derive the answer even from theory.
Any particular strategy you had about attempting the paper? Like there were this is
Yes,
paper
sir.
is where there is a differential marking scheme for
Yes,
each
sir.
part. Any particular strategy you had in mind?
So sir, there are 200 questions and 150 are single choice, single best response, and the negative marking is not that much. So I was aggressive in that. I attempted 146 questions out of 150, but in total, like there were 288 options, but I didn't really check that because I was writing down the marks, like the like how much I am attempting as per marks. So out of 200, I attempted 187.2, because I think like earlier we used to do 190 to 195, but with this new pattern, especially in sequence, like there were 5 sequence questions, I attempted 3 and I got 2 wrong, so ultimately it was -1. So I think you have to be aggressive in single best response, and you have to answer only when you are sure in sequence based, match the following, and true and false.
Yeah.
And I think like 185 to 190 marks should be your goal.
And I think another good point that he has brought up is that please utilize that back of your roll number or
Yes,
the,
sir,
the
yes,
rough
sir.
sheet, please.
Yes, sir.
Because instead of marking everything in the
Yes, sir.
computer for review, you may
Yes,
not
sir.
get time in the end. So it's a good idea to utilize the sheet and you can do this practice when you're giving a grand test to
Yes.
utilize the sheet so that you get a habit of
Yes,
doing
sir.
it.
So what I did was like during my when I was giving tests in my room, I used to do this only, write it on a paper. I was not really sure whether they would give a paper or not, but I thought anyways I'll do that in mind if they don't give a paper, which they did.
Yeah.
So, and like you have to be quick, because when I used to solve papers in my room, I used to take only 2 hours and 20 minutes. But when you are in exam center, you will be stressed, and that you'll take 20-30 minutes more. So I think you have to be quicker, and like you have to be quick from the starting only. Like it's not like you can spend more than 2-3 minutes in a question. If you don't know the answer, just mark it for review.
And this year, Anurag, you'll be happy to know that this year we have introduced two new features for our classroom program. One, we have introduced that practical videos,
Yes.
especially in surgery, that
Yes,
is
sir.
already live now. We have done all the patient examinations,
Yes, sir.
created videos. The medicine part is going on. So, our goal is to, have that comprehensive
Yes,
resource
sir.
in the end
Yes,
to
sir.
look at that clinical
Yes,
science
sir.
also. And second thing we are doing now is that for the TND session now, because a lot of interns are attending, now we will have the video access of the discussion for the student after the test is over. So suppose somebody missed, there is an option to attend it on the app also for them. We're
Yes, sir.
creating a hybrid kind of
Yes.
mechanism. So another thing I wanted to know was, how did you maintain your entire mindset? Like it would have been,
Yes.
there were, we were talking
Yes,
about
sir.
it. There were ups and downs. It is not so easy to manage. Any advices, and how you coped up with, the stresses happening in life and the exam?
sir.
How did you do this?
So, I mean, like my pace was good when I started in seriously in January. So initially it was going good. It went great. Like I got good ranks in tests and all. So I thought it was good. But then in some grand tests I used to get ranks in hundreds, but which like 100 rank is not that great if you want some particular branches at particular college. So like I got somewhat stressed, and then there were some other personal reasons, like I had a breakup. So then I developed acute stress reaction in October. So at that time I consulted a psychiatrist, like what to do, like I have to focus so much. So he told me to just pick up any habit like running and or something which occupies my mind and refreshes me. So that's what I did. I used to do meditate or run, and then I used to study. And like in even in the last week I was stressed, like I was not able to study properly because I was not able to focus. So then I watched videos. Basically you don't have to waste your time. If you are not able to read, then watch videos. If you are not able to watch videos, then discuss with some friend, or like make some short notes for yourself. And during the 3 hours of the exam, I was constantly checking my pulse rate, because actually I was breathing very heavily. So I thought what to do. But then I thought, okay, it's my body trying to give more oxygen to my brain, so take it in a positive way. So I think you have to be very positive, and if there is something which you can't change, then try to find a way around it, and like take care of your mental health.
Yeah.
That's most important.
And I also believe that that giving a test before the main exam is also a good idea,
Yes,
to get
sir.
that sensitization to
Yes,
that.
sir.
Because there would be you will have that stress when you give the
Yes.
CBT for the first time. And another thing I would want to know from you now is that now that you had to deal with the stress and the exam, everything put together, do you want to give a message to all future aspirants that it is okay, that things would happen, it is life, but in the end, if somehow we can
Yes.
cling on to some purpose in life, we are able to pull across. So I believe that when you came out of it, I think that physical activity helped. Running,
Yes, sir.
I think
Definitely.
it's a good idea, because I feel a lot of people, when they are preparing, there's no physical activity getting
Yes, sir.
involved. And that also, when you do that, there is a
Yes,
release,
sir.
stress release.
Yes, sir. Meditation also helps. And then, sir, it is very important to have a good support system.
Yes.
Like you don't like we are medicos. It is it is should not be stigmatized. If you think you need help, then you go to someone. I went to my friends, and whenever I felt like crying, I cried in front of them. So yeah, I think support system and physical exercise, these two are the main things which you should do.
Yeah. And it is better to start prophylactically rather
Yes.
than
Yes, sir.
as a
Prevention is better than
prevention is
cure,
better
sir.
And please take care of yourself. Please, you are more important than any exam. Your life is bigger than anything else. So we have to keep all perspectives in mind. And we have to know that at the end of the day, even if we are doctors, we are not machines.
Yes, sir.
So, although we want to believe that,
Yes, sir.
we want to believe that, that we
Yes,
are
sir.
like, but when it hits us, it hits us.
Yes, sir. I try to calculate my time mathematically. Like I'll go from 9 to 5 in internship. I'll take 1 hour break and then I'll study. Then I'll take 1 hour break. But it doesn't happen like that. Your life is not mathematics. You are not a robot.
But at the end of the day, I want everybody to appreciate that he is still at rank 65. He could manage a top 100 rank because he understood what is going wrong, and he planned it accordingly.
Yes.
And he accepted that, okay, this is a very mathematical formula that I've made for myself, and it's not all
Yes, sir.
working out. It's it's so great to talk to you, Anurag.
Thank you, sir.
And I would now, because now that I know, and I would also want to tell you here also that now once you have come out of a scenario like this,
Yes.
you become stronger,
Yes, sir.
and you will achieve more in life after this. I'm
Yes,
telling
sir.
you. And I also would now want to wish you all the best for your future, because I believe that you'll be able to do much better now, much better, because you
Thank you, sir.
come out strong out of everything that happened, all the stress and everything. Now and now when you look back, it was just an exam.
Yes, sir.
It's just exam. It's just a computer
Yes,
center,
sir.
just clicking. I'm sure you'll do better
Yes,
in
sir.
all future exams as well. Any particular teachers that come to your mind today?
So, sir, you first of all, when like 7 days before exam, I watched your videos what to do in the last 7 days, and in the end of that video, you said do that great so that we call you for interview, and I commented on that video also, sir. You might remember.
I
Yes,
know,
sir.
I know. I replied
I-
also, that
yes,
you will
sir.
definitely
Yes, sir.
come.
Yes,
It is
sir.
such a pleasure that you did it prophylactic. You did
Yes,
it
sir.
earlier only. That I'll come for interview.
Yes, sir.
That is, I'm so happy to hear that.
Yes,
I
sir.
replied it on YouTube.
Yes, sir.
And I think that message is still there.
Yes, sir. Message is still there.
It's very nice. I think that also works. That when you, with conviction, say something, you're also telling yourself
Yes,
that this
sir.
is my conviction. I'll make it happen.
Yes, sir. I used to repeat, I am the best, or I will do this.
Yeah.
Like I think, like in Napoleon Hill also wrote in his book about auto suggestion.
Yeah.
I think auto suggestion helps.
Yes. You have to believe it that you are somebody special. You'll do something big. Otherwise, what happens is that negativity kind of pulls you down.
Yes.
And any other teachers that come to your mind today?
Deepthi ma'am, like her notes are gold standard. That's what I can say. In ENT, Deepak sir's notes were great, and for ortho, I attended Tushar Mehta sir's class. Like, and he was very conceptual, and like he told some case scenarios which got ingrained in my mind. Like if a patient comes like limping, I have to think of this and that. So I think that was very great. And so like all the teachers helped. Anupama ma'am's notes, they were really great. I revised them in the last few days before exam, because as I told earlier in the video, anatomy and physiology were my weak subjects. So I think you have to focus on your weak subjects so that you at least don't get the questions wrong which others are getting right. If you have to get rank, then you can get through your strong subjects, but you have to just level out the subject.
There should be no subject where
Yes,
you
sir.
are zero.
Yes,
You
sir.
should be at least average or above average
Yes,
for
sir.
everything, and definitely very good in some of
In
them
some
to
subjects,
build up
yes, sir.
the rank
Yes,
scores.
sir.
Yeah. Any final message for the aspirants, future aspirants? Any final tip
So
or
like-
fire in the belly kind of a line?
Uh, so I guess it's just a marathon. Like if you get, like if you are not able to run for a few days, it doesn't matter, because like it's so long journey that if some days of like despair will come in your life. So yeah, if you have worked for the 5.5 years, or even for 3 years or 2 years, it will pay off.
And on that note, I would like to once again wish you all the best, and I would like to remind the listeners that medicine is not a one-day career, it is not a 2-day career, it's not a 3-year career, it's not a 5-year career, it's a lifelong kind of a thing. And you need to look at medical career in long term, and I'm sure once you start having that long term vision, you will be able to do better in life. And with that note, Anurag, I would like to once again congratulate you.
Thank you, sir.
And convey my congratulations to your parents as well. I'm sure they will be very proud of you today.
Yes.
God bless.
Thank you, sir.
God bless.